A dental implant replaces more than the visible part of a missing tooth. Treatment usually involves diagnosis, implant placement, healing, and the attachment of a final restoration. The first step is a clinical assessment. The dentist reviews your teeth, gums, bite, medical history, and treatment goals. X-rays or a CBCT scan may be required to assess the jawbone and nearby anatomical structures. The clinical team then plans the implant position and the future tooth. Bone volume, gum condition, the space between the teeth and the final restoration must all be considered together. Some patients can proceed directly to implant placement. Others may first require treatment for gum disease, tooth extraction, bone grafting, or another preparatory procedure. These steps are not required in every case. During implant placement, the area is normally numbed with local anesthetic. The implant site is prepared carefully, and the implant is positioned in the jawbone according to the treatment plan. A temporary tooth may sometimes be provided depending on implant stability, the treatment area, bite forces, and the clinical plan. Immediate temporary teeth are not suitable in every case. The implant is then given time to heal. During osseointegration, the surrounding bone develops a stable connection with the implant. The required healing period varies between patients and may be longer after bone grafting. After the implant is ready for restoration, an abutment is connected. A digital scan or impression records the position, gum shape, bite, and surrounding teeth for the final restoration. The final implant crown is fitted after its shape, bite, contact, and appearance have been checked. The goal is a restoration that functions comfortably and can be maintained properly. Dental implants still require daily cleaning and professional follow-up. At Renova Clinic, the final sequence and timing are personalized after examination and imaging because no two implant cases are exactly the same.